student today. I'm here to do a cardiovascular and peripheral vascular system assessment on you. It'll probably take 10 to 15 minutes. Is that okay? Yes. Okay. I'm gonna wash my hands. And please state your name and date of birth.
Brooke Simpson, 7/8/2000.
Great. So I'm just gonna start with some history questions. Have you been having any chest pain, any leg pain? Have you noticed a change in your skin or the color of it? Okay, and then do you have any family history of cardiovascular disease? Okay, so first I'm just going to be inspecting your skin. I see that it is the appropriate color for your ethnicity. I don't see any pallor, cyanosis, or any edema. And then I'm going to have you put your fingers together. I know we did this a couple weeks ago. I don't see any signs of clubbing, so that's intact. I see that your hair is evenly distributed and your venous pattern is intact throughout. All right, I'm gonna have you lay down for me. It's a 30 to 45 degree angle, and I'm just going to check. I don't see any jugular vein distension, and your precordium, I don't see any lifts, heaves, or pulsations. You can go ahead and sit up for me. Also, while inspecting your skin, I didn't see any lesions. If I did, I would definitely document those. Next, I'm just gonna go to palpating your skin. And your skin is warm to touch. It's not overly cold or overly hot anywhere. Then I'm just gonna check your capillary refill. And it is less than 3 seconds everywhere. So capillary refill is intact. And then I'm going to check your pulses. Start with your carotid. These I do one at a time, just so we keep the blood flow to your head. All the others I'll do together to make sure that they are equally bilaterally strong. That's your radial, then your brachial, and then your femoral would be here, and then your popliteal, your posterior tibialis, and your dorsalis pedis. And I could feel all of them, and they are a 2+, which is normal for rating pulses. Next, I'm going to auscultate. I'm going to start here at your suprasternal notch and go down to find your angle of Louis, and that'll be my reference point for listening to your heart. So I'm going to go to the aortic valve. Your S2 is louder than S1. Your pulmonic, S2 is louder than S1. Your herbs, the two sounds are equal. Your tricuspid, S1 is louder than S2. And your mitral, S1 is louder than S2. I'm gonna sit here and I'm gonna count for 60 seconds and get your apical pulse. And it is regular. And after that, I would switch to my bell. I would go backwards. I'm just listening for any extra heart sounds or murmurs. And you are negative for extra heart sounds and murmurs. Next, I'm gonna have you exhale and hold your breath. I'm just checking your carotid for any bruise. It would be a swooshing type sound, and I don't hear any, so you can go back to breathing normally. Okay, so there are 3 other tests that I would do if I needed to. First would be the modified Allen. I'd have you make a fist, and I would occlude your ulnar and radial arteries, and then I would have you extend, and I can see that the capillary refill back into your hands is intact, and there's adequate circulation from both arteries. Next, I would, if I couldn't feel any pulses, then I would use a Doppler and It's kind of like an ultrasound for your pulses. And then the last one that I would do is measure the circumference of the widest part of your calf, and that's just to fit you for any TED hose to get that circulation in your legs if you're laying in bed a lot and stuff, and your mobility is down. And then when I was palpating and looking, I didn't see any edema, pitting or non. If I did, we would rate it 1+ to 4+, 1+ being mild, 4+ being a deep edema, and that's if I press down, the indentation would stay for a while. Okay? Do you have any questions for me? Alrighty, well thank you for your time, and I'll be back in about an hour to check on you.
Okay, thank you.